The following recording is an extract from the BBS UK Medical Information Booklet and includes information about renal abnormalities in Bardet-Biedl syndrome, BBS. Information about other features of BBS, genetics, diagnosis and family planning, the specialist BBS clinics, and the charity, BBS UK can be found on the BBS UK YouTube channel and on the BBS UK website. The medical information booklet can also be downloaded from the BBS UK website www.bbsuk.org.uk. The information contained within the medical information booklet has been provided and checked by the BBS Specialist Clinics team and where possible is supported by research and published articles. A full list of references can be obtained from tonia.heimers@bbsuk.org.uk. Bardet-Biedl syndrome clinical features and presentation. Renal. Although Bardet-Biedl syndrome, BBS, can affect the kidneys in a number of ways, significant kidney problems and kidney failure are seen in only a small proportion of patients. Nevertheless, it is important to monitor all patients regularly. Minor kidney problems and high blood pressure are more common. Therefore, blood and urine tests and ultrasound scanning of the kidney should be a routine aspect of renal management in BBS. Kidney manifestations can be quite variable in BBS. Patients can have kidneys that have not formed correctly, renal malformations, kidney cysts or other variations in the shape and size of the kidneys. Generally, these abnormalities do not cause too much trouble. In about 5% to 10% of people with BBS, the kidney function declines progressively, causing a rise in the serum creatinine and a fall in the eGFR, estimated glomerular filtration rate, a measure of the function of the kidneys. This may culminate in kidney failure and the need for dialysis or kidney transplant. This usually occurs in the first few decades of life and in general, if kidney function is normal at the age of 20, then it is unlikely to decline later in life. Patients with BBS seem to do very well with dialysis and kidney transplantation, so even if kidney failure does develop, there are very good treatments to support patients. One particularly common problem related to the kidneys can be a reduced capacity to concentrate the urine. This leads to a higher than average urine output and sometimes excessive thirst, although few patients notice this. Infections of the bladder, cystitis, and occasionally of the kidneys themselves can also occur and are treated in the conventional way with antibiotics. Hypertension, elevated blood pressure, may be evident in patients with kidney disease of any type, and in BBS hypertension is often present and should therefore be regularly checked and treated if necessary. Hypertension can also put further strain on the kidneys, so in BBS patients, where there is a known kidney involvement, it is particularly important to monitor and treat this. As already noted, obesity is a very common problem in people with BBS, and excessive body weight can put additional strain on the kidneys and make high blood pressure worse. This can exacerbate any underlying kidney problems, or can even occasionally cause kidney damage on its own. The rationale for managing weight in BBS therefore extends to protecting the kidneys from damage. Assessment at diagnosis should include check symptoms of anemia, polyuria, and polydipsia. Baseline blood pressure assessment, 24-hour blood pressure monitoring. Measure plasma creatinine, urea electrolytes, GFR. Bladder and renal ultrasound examination. Follow-up assessment should include yearly for symptoms check, baseline blood pressure, yearly early morning urine analysis for albumin, creatinine, ratio and dipstick testing for microscopic hematuria, yearly monitoring of plasma creatinine, urea and electrolytes, GFR. For further support or information, National Kidney Federation, www.kidney.org.uk, 0845 601 0209. British Kidney Patient Association, www.bkpA.org.uk. britishkidney-pa.co.uk 01420 541 424. This information is meant as a guide only. If you feel concerned about anything you have heard, please seek medical advice from your GP, consultant, or a member of the BBS Clinics team. We welcome your comments and feedback. Please send to info@bbsuk.org.uk or tonia.heimers@bbsuk.org.uk.